Welcome to Tea Talk. Today we're going to discuss tooth sensitivity. It's a big issue for a lot of folks, patients, and I want to make sure that we give you a good overview of what you can expect and some treatments you can use to help with it because it can be very painful, as I well know. My name is Becky Moore. I'm a dental hygienist and I am Restart Hygiene and Tea Talk here to help you. So let's dive in. All right, so let's talk about teeth and why they're sensitive. So first of all, we like to talk about the structure of a tooth. I have a diagram here that will show you the tooth. So many of us know the pretty white spot, that's your enamel. The inside is the dentin layer, and once your gums recede down, that layer, that cementum and dentin layers are exposed. The nerve is the inside of your tooth. So this is what's feeling the pain coming from out here. So that's important to understand. Now, we have an enamel layer, a dentin layer, and the pulp. So you see that. Now, tooth sensitivity occurs when the dentin becomes exposed. So as long as your enamel is out and there's no cracks in your enamel, they're usually not going to be sensitive. Now, when you brush too hard or you clench your teeth, your gums recede. Gum recession is a natural order of life with your teeth. So once your dentin becomes exposed, that organic soft layer, it causes a lot of sensitivity. A lot of times it can be to cold, like this says, hot. To toothbrushing, can it be that as well? And then the foods that you eat can cause it as well. So gum recession is the number one reason. That's the number one reason most of us have sensitivity. So when the gums recede, the underlying dentin is exposed. So that is like a hot spot or a cold spot. Enamel erosion. So when we eat or drink acidic foods and beverages, we can have the enamel layer start to break down. So it takes that enamel layer off. It's only a few millimeters when your teeth come in. So when your teeth erupt, you only have a few millimeters. I'm talking about millimeters. Tiny, tiny spots of enamel on your teeth. So you don't have a lot to work with. But over time, acidic foods from bacteria and sugars or just plain acid foods, acidic foods, can cause that enamel layer to thin. And that breaks down the enamel layer. The next thing is tooth decay. So if you have a bad cavity or even a small cavity sometimes, it can be really painful. So if you have a break in the enamel where that nerve is being stimulated, you're going to have a sensitive tooth as well. And then, of course, cracked teeth. So fractures or cracks in the enamel. Your enamel, like I said, is only a few millimeters thick. And when you chew on it hard, and we even talk about ice. Ice chewing is not good for you, so make sure you're not chewing ice. But that can wear that enamel layer down, and it can cause it to be fractured or broken. And that allows the stimuli to get down into that nerve. So that's what we want to make sure we understand. So now that we understand the causes, let's talk about some ways to treat tooth sensitivity, because that's the main goal. Once your roots are exposed for longer periods of time, exposed to fluoride, and the saliva has a chance to remineralize, they're not as sensitive. So over time, keeping your teeth clean actually helps to make them less sensitive. It's like being exposed. The nerves are first exposed, so they're really hypersensitive. Once they get used to that environment, they become less sensitive, which is good. So you want to make sure that you're brushing with a soft bristle toothbrush. These areas still need to be brushed. It's really, really important that you brush your teeth, even if it is a little sensitive, with a non-abrasive toothpaste and a very gentle pressure. So a very soft toothbrush, gentle pressure, with probably a sensitive toothpaste is what I would recommend. And I have one of those here. So this is one example that I like to use. Potassium nitrate and sodium fluoride or stannous fluoride are the ingredients that will help soothe the nerve, and it will help protect it with the fluoride. So remember that. Flossing. Sometimes the sensitivity is coming from between the teeth, so you want to make sure that you're cleaning between the teeth well too, so that the sensitivity won't come from that. And like I said, the longer the tooth is exposed, the more fluoride it has, the more minerals it has to remineralize, it's less sensitive, which is a good thing. Use a fluoride mouthwash or a toothpaste like we just discussed can help you. Rinse with tap water after you eat or drink something, and don't brush your teeth for at least 30 minutes. We want the saliva to do its job. So when you drink water, it brings the pH levels up to neutral, so the acids can't form and do harm. That gives you time for your saliva to regenerate and soothe and coat your teeth, and that helps remineralize the teeth and make them stronger. So that's important to know too. Now, diet modification. So what can you do as far as your diet? Sometimes your diet is the cause, sometimes it's not, sometimes it's just a contributing factor. So reduce your consumption of acidic foods. Coffee is the number one acidic foods that I come across as a clinical hygienist. Also, these energy drinks that you're drinking are also very, very high. And Gatorade, a lot of our children are drinking Gatorades on the field. They're very athletic. They're trying to remineralize their bodies, and those can be very acidic as well. So remember that. Citrus foods, carbonated drinks, and vinegar based. Like if you like to drink pickle juice, that is very acidic on your teeth. Good for your body, but bad for your teeth. So remember that. Everything in moderation. All right, so beverages too, sweet tea is one, soft drinks are another. Even a diet drink still has acid in it, so you're still getting that exposure to the teeth. So remember that as well. And then try to remember to make good choices. So if dairy foods they're high in calcium. Your body needs calcium to make it stronger, the teeth as well. And also leafy green vegetables and crunchy fruits and vegetables. Believe it or not, they clean the teeth. They're low in acid and no sugar, or very low in sugar, and they will help you as well. All right, so if you've got sensitive teeth, what in the world can you do? Well, there's a couple things that I'm going to tell you that you can do that can help you. So the sensitive toothpaste is a really good option to do. And what I tell patients to do, sometimes one of my tips and tricks would be to brush your teeth for the full 2 minutes with the sensitive toothpaste. If you have 1 or 2 spots or whatever spots that are very, very hypersensitive, then just put a drop of your sensitive toothpaste on your fingertip, rub it along the areas that are sensitive, and just let it sit there. That gives you an increased amount of this potassium nitrate and fluoride, and that will help you with your sensitivities as well. So do that a couple times, and I think you'll see an improvement. Also, rinsing with salt water helps to soothe your tissues. Keep everything clean. Cleanliness is really important. Even if you have a little sore in your mouth, keeping it clean will help it heal faster, which that's off the subject. But aloe vera also is good for you, and coconut oil pulling. Coconut oil is very antiseptic, antibacterial, antifungal, and I've said it before, but if you keep your teeth clean, that decreases the sensitivity. So that's something that you can do. It will help you with the other areas as well, as we've discussed in other videos. So the other thing is the hard one. This is the really, really hard one. Reduce your stress. A lot of times when you have sensitive teeth, it's coming from a habit like clenching or grinding. Most of us do this at night, and we're totally unaware of it, so we don't know we're doing it. It takes you a while to figure it out sometimes. When you see your hygienist, she or he may say, looks like you're clenching or grinding, and there's things that we look for. But that can really cause your teeth to be sensitive because, again, you're putting that undue pressure like chewing ice on it, and that pressure is being absorbed by your enamel, and your enamel is not made to do that over a period of time. Not with 500 pounds of pressure chewing and biting, even when you're not chewing or eating food. So it's important to know that. So try to do the correct tongue posture, which we have in a past video. Go to sleep like that. That will help you too. But to decrease the bruxism, if you're doing it, you just can't break the habit, then you need a night guard. So I want you to see your dentist about that. And so reduce your stress. Try to do some breathing exercises. Try to maybe meditate, pray. Just get your mind to a better place. Get your tongue in the right place. And hopefully that'll help you as well. All right, so these are some suggestions. I have other suggestions that I'll be putting in future videos, but these are a few suggestions that I would say that will help you the very most if you have an immediate need and tooth sensitivity. So I want you to hopefully take one of these with you and see what you can do. Always recommend seeing your dentist, your hygienist. They can make recommendations too. They have prescription strength medication or a toothpaste in the office that they can give you, or they can sell you, or they can prescribe for you that can also help with your sensitivity. So that's important to note as well. So if you have any comments, please put them below. If you like, please like and subscribe if you can. And if there's something that you want to learn about that I haven't discussed yet, I would love to hear your suggestions so that I can serve you. So I will see you next time. Thanks for tuning in.